Hi, and welcome to another episode of Hot Takes with me, the Silver Fox. Things are just going from bad to worse when it comes to the Queen Elizabeth University Hospital in Glasgow. Dubbed the Death Star over the number of people who are dying there, various reasons. Often it's down to sort of poor management, but there is also the cases of all those who've died from infections in a hospital where during the build stage they were told that there were infections. It's a problem so bad that they're now indicted as a possible corporate homicide case. Never before seen in Scotland, but that's how bad the hospital is. This is also the hospital, of course, that hired private detectives to go after the relatives of patients who died of COVID and who were critical. It's done so many bad things. We've done so much reporting on the awfulness of this hospital that it seems almost incapable of getting worse. And yet worse it has. It's failed to safeguard the safety of children. Again, further endangering them due to lack of security. I think the time is up for this hospital's board. They must all be fired. Let's have a look and see what's going on yet again at the QEUH. Here goes. So, man charged with impersonating a nurse to gain access to the children's ward at Glasgow Hospital. Now, of course, initially you've got to say it is down to the individual himself who pretended to be a nurse to gain the access. He is ultimately to blame. However, having a hospital whose security is so lax that this is even possible is, I think, in some way a bit weird. It is another indictment to the very lack of management and security at this hospital. It's a hospital doomed to fail from the very beginning, and fail is all it has done. Lee Woods, 28, from Greenock, is said to have behaved in a disorderly manner, with the alleged breach of security now being investigated by NHS Scotland's counter-fraud team. I think it needs to be investigated by the police. A man has been charged with impersonating a nurse by wearing a uniform and carrying a fake NHS ID badge to access a children's ward at Scotland's biggest and worst, it may be argued, hospital. It is said to have happened on a number of occasions at the QEUH in Glasgow over a 5-month period last year. Lee Woods has since been arrested and charged in connection with impersonating a member of staff. I think he also needs to be arrested and charged with endangerment of children. It's obvious that that was what the target was. The 28-year-old from Greenock is due to appear in court in the new year. The allegations are the latest blow to the reputation of the £842 million super hospital, which has been the centre of several high-profile incidents since it opened in 2015. It is probably one of the worst hospitals ever done. It was doomed from the very start. People who were building it were telling them, the management, there is problems here. There is infection. There is slime. There is mould. There is fungus. It needs to be cleaned. And they didn't clean it. They were told about the fact that the air conditioning was the wrong sort, and they did nothing. They were told about dead pigeons in the air supply and in the water supply, and they did nothing. They just couldn't be bothered. People have died. There's police investigations. There's all sorts of things going on. And as I say, they're currently, as part of the Great Glasgow and Clyde as well, under sort of suspicion as being pertinent to potential corporate homicide charges. This is how bad this hospital is, and nobody wants to take responsibility, but I think they may end up taking a lot of responsibility to the point of jail terms for the board, which is what it needs. It is claimed Woods entered the hospital on the city's south side impersonating a charge nurse, and once there, it is said he gained access to the children's areas and the resuscitation units, where he allegedly behaved in a disorderly manner. It's also alleged that Woods wore an NHS lanyard. He was arrested and charged on Tuesday, July the 18th, when it's claimed he was caught with a forged ID badge. The alleged breach of security prompted an immediate investigation by the NHS National Services Scotland's counter-fraud team. According to the Scottish Sun, an urgent alert to staff was subsequently issued. It stated, on the 18th of July, a male was arrested and charged, having been apprehended allegedly impersonating a nurse at the QEUH. Following the review, it was identified that this person had allegedly accessed the hospital in this way on a number of occasions between March and the date of his arrest. The male was allegedly wearing an NHS uniform with a lanyard and a falsified identification badge detailing his position as a charge nurse. I mean, how difficult is it? You know, people... Now, I don't know. Well, I'll put this in a different way. Where I go to hospital, it's the NHS. The NHS hospital is Northampton. Now, to get through doors, into certain areas, you have to be swiped in, and they have swipeable cards. You can't fake them; they have to be issued. So you can't just go and make up a pretendy ID badge and try and get in. It won't let you. So how do you do it? You know, perhaps you can sort of barge in behind someone, pretend you're with them, etc. Perhaps, but surely some basic security. If you're someone on a ward and you see someone you don't recognise in a uniform, just check the ID badge. It's not hard. Barry McDines, NHS Lanarkshire Deputy Director of Property and Support Services Division, said NHS National Services Scotland Counter Fraud Services, that is a big title, can we not make that simpler, issued an alert notice to health boards regarding a security breach out with Lanarkshire. And on the back of this, we took the opportunity to remind our staff of the importance of wearing their identification in the workplace and to remain vigilant and report any suspicious activity to their line manager. I've just said that. Just keep checking, just look at people. A Police Scotland spokesman said a 28-year-old man was arrested and charged in connection with impersonating a member of staff, and we've just covered that. It is appalling that the security is so lax that literally a man off the street can walk into a children's ward. There is no limit to the damage he could have done. And nobody thought to check him. Nobody thought to question him. Nobody thought, who the hell is that person that I haven't seen before in a children's ward? It's just beyond a joke, isn't it, this hospital? It needs to be gutted top to bottom. Anyway, Greater Glasgow and Clyde spokesman said the safety of our patients, staff and visitors all across our sites is a priority to the NHS Glasgow and Clyde. Well, we know that's bullshit, because when they're not busy killing them, they're busy investigating them. He says, we can confirm that an individual was arrested and whatever, blah, 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 after the authorities, we don't care. He said, we'd like to assure members of the public that our on-site security teams work very hard. Well, I would suggest they don't work hard enough. It's just awful anyway. Police Scotland have taken over and there's a full investigation. And he's going to court in the new year. Let's hope he gets a suspiciously heavy sentence. But this is not suspiciously a suitably heavy sentence. But given that this is the SNP run justice system, and they're not that fussed about kids, so he'll probably get away and probably won't even go to jail. Because, it's just... It gets worse. Every time I look at this hospital, there's another story. And it's a bad story. And the stories are getting worse. Stop it. Fire the board. Get in people who are competent. And make sure every member of staff, be they medical, admin, tertiary, whatever, check IDs. If you see someone you don't recognise, question it. Especially in areas where there's like children and vulnerable adults and things like that. There's no limit to what this guy could have done. We're going to have to look at Lucy Letby, see an example of what happens when rogue agents get into hospitals. Anyway, I shall stop there and come up, but I'm just my mind is whirring. I will say, if you're one of the poor unfortunates that find yourself within the catchment area of that hospital, and you have either inpatient or outpatient appointment, or you get taken in for whatever reason, when anyone approaches you from now on, take a look at their ID badge. Make sure it's real. Make sure the picture matches who it is. Question them. Ask another person, is this person working here? because you just don't know. You know, you can have someone there with ill intent. It's stunning that this can happen. Anyway, I don't say it's stunning it can happen. I'd be stunned if it happened anywhere else. But this is the QEUH, so we really shouldn't be stunned by it. It should just be taken as normal. Anyway, I'll stop there. Thank you very much for watching. I hope I've suitably frightened you. It goes to show how bad things are that happens. Till next time, stay safe, stay well. Please, God, don't go to hospital. And goodbye. Unbelievable.